Hello, everyone. This is Dr. Hope Watts, board certified family physician, speaker, health coach, and lifestyle expert. Today, I'm going to revisit the topic that we discussed last week and some different topics this time, going back to some of the things we talked about with COVID-19 and elaborating on some others. Firstly, just to review, we talked about some of the risk groups for COVID-19, and they include people in the age groups of 60 to 70 on up. We also talked about certain illnesses that can put people at risk, and some of those diseases include, I'll just give you a short list: hypertension, diabetes, heart disease, asthma, being on a dialysis unit, just to name a few. And we did talk about the symptoms of COVID-19. Some of the earlier symptoms include cough, fever, fatigue, change in your taste or smell, and of course, a lot of times when people have fevers, they don't feel like eating anything and they don't feel like getting up and doing their regular duties. And we also talked about how to protect yourself with face coverings and masks, and doing hand washing and keeping your social distance. Today, we're going to talk about how to make sure that you are aware of other ways that the virus can spread that you may have thought about before, but in view of all the other advertisements, all the news updates about COVID-19, you may not have remembered some of these areas. And we'll talk about testing and who needs to get tested. Just wanted to let you know there are many common areas that can pick up viruses and bacteria for that matter. And I've noticed that when I go into the supermarket, I find that many places have someone who is actively cleaning down the railing of the carts that you push in to the supermarket. And they have traditionally been an area of very high contamination. So it's good that they are doing that. Some of the other places that we may take for granted are doorknobs, our touch tone screens on our computers, because we're touching it all the time and we may not be washing hands in between. Any device that you may have, that includes the cell phones, our tablets, the keys on the laptops, and any surface that, especially if you're at work, there may be other surfaces such as the water cooler, and there may be barriers in between each desk. People stand there, they put their hands on there, on the table surfaces. They may be also other areas of contamination. Additionally, the bathrooms present a consistent problem long before COVID-19. For example, the bathroom faucets are well known to have be contaminated. And in many places, when you go into the bathroom and you've washed your hands, they like to have a trash can nearby, so that after you dry your hands, you can actually take the towel, paper towel, and hold the door, get your foot in the door, throw the towel away, and you have not touched the handle of the door at all. So please be really aware of that. And in some areas, they still have the handheld flushers, little bars that come out. Most places have gone to these automatic hand flushers, and they are probably the safest because you don't have to touch anything. But if you find yourself in a bathroom where there is no way you have to use your hands. I do have to say that some people use their feet to flush the toilet. Make sure you do wash your hands thoroughly after touching those areas. Other areas that you may come into contact with are counters in various places, especially when you go to Lowe's or Home Depot. There are places in there that are definitely contaminated because people come in all the time, and there are areas that people just touch. So also escalators, elevators, touching those buttons on the elevators can also be areas of contamination. So our suggestion and recommendation is that when you're in these areas, make sure you're washing your hands and that you have sanitizers nearby so that if you feel you've touched something inadvertently, at least you have the hand sanitizer with you. And again, the recommendation is to use a hand sanitizer that's at least 60% alcohol. I have actually seen some with higher amounts of alcohol in them, but still you will be getting rid of the bulk of the bacteria. And again, the hand washing as often as possible. I cannot emphasize that. The other reason why we're doing a lot of hand washing is to decontaminate our hands and our nails, because it is estimated that we touch our face at least 3 to 30 times a day. I was shocked, sort of. I have allergies, and sometimes my nose is itching. Sometimes I'm sneezing. And so I have to be extra careful because I could contaminate my face, my eyes, or my mouth. So the recommendation is to avoid touching your face, especially in the areas of your eyes, nose, and mouth, because the virus can get access through these areas. And always, 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 if you're not sure how long it's been since you've washed your hands before, you can always use hand sanitizer. And I just wanted to review the correct hand washing again for you. It is recommended that you use the type of soap that lathers a lot. There's no real difference between the liquid soap or the bar soap. So get your hands and lather them up real good, and lather them for 20 seconds. Now, with children, you really need to watch what they're doing. Kids like to splash around in the water, and they may not be actually washing their hands. So you may have to supervise that and make sure that they're actually washing their hands completely. And you may want to have them sing the birthday song at least twice, because the birthday song by itself is about 20 minutes. And if they do it at least twice, at least 40 minutes, you know they've completed washing their hands in that case. And you yourselves can use a birthday song too to make sure you've washed your hands thoroughly. Also, there are other places around your house that you may want to make sure you're washing your hands after. Some of these are common sense things, but I thought in view of the coronavirus and moving in and out of our homes, since some of us are going out a little bit more, that we would take extra precautions. Some of them are very, very common, such as preparing meals or eating. Most people do that anyway, but just a reminder. Treating wounds from a sick person, especially someone who you know has a very low immune system. Touching pets, animals, or animal waste. I've noticed that a lot of people have gloves on when they are picking up the waste from their animals, and that should be done all the time. That should not be an exception. Also, blowing noses, coughing, and sneezing. And I have to make sure I do that myself, as I said before. Handling garbage or anything that you feel is contaminated. Um, so good hand washing is always in vogue, whether it's coronavirus or not. Let's make sure that we're doing those things to keep ourselves safe. I wanted to also talk about testing for the coronavirus. We see the lines in various places in the country, and there are at least two types of testing that are very, very common. Um, the first test is a viral test, and the second test is an antibody test. The viral tests are the most common types of tests because they actually tell whether you have a current COVID-19 infection. The antibody tests test you to see if you've had COVID-19 before. Usually the testing can be done at a public health center, and in many places there are, if you go online to the public health center in your city or county or state, they have places where you can go and get free testing, or you can contact your doctor's office to find out if you can get testing there. But I just need to bring home the point that if you get a negative COVID-19 test, that does not mean that you are to stop doing the hand washing, the social distancing, or wearing the face masks. We reviewed that last time, but I'll review it again just for the sake of those who may not have heard me last time. CDC recommends that we all use face masks, especially going out to other places outside of our homes, and some places outside also. Social distancing is 6 feet away from another person, and they recommend very strict hand washing or using a hand sanitizer. So if you feel that you should be tested for the COVID-19 virus, usually if you find the testing places, you can go ahead and get tested, or you can contact your doctor. And a lot of times the test is positive, especially since we're having these hotspots flare up, and there are lots of people who don't have a lot of symptoms. They feel like they may have been around someone with the COVID-19 virus, or they were in an area and there were a lot of people crowded together and they inadvertently found themselves in an area like that, or they were waiting to get their food or something. So they may have elected to get testing and they're not having any symptoms, but the test can come back positive. And as we just discussed, do not stop doing your preventative measures to prevent the spread of COVID-19. Also, if you do have COVID-19 or the test comes back positive, your doctor is just going to probably tell you to stay at home, self-isolate for at least 14 days. Now, I have heard that a lot of people don't feel better by 14 days, and in some cases, it may take up to 21 days, especially if you're working at a facility such as a nursing home or at a hospital. You need to really talk with your doctor about when it's safe for you to go back to work. Some places want to have a second negative COVID-19 test before they feel it's adequate time for you to go back to work. And the fact that some of the symptoms can linger. And I know for a fact that there are some persons, depending on where they work at, have been waiting, or their doctors have been waiting for at least 21 days. Now, I know there are some out there who say, oh, if it's COVID-19, I'll just stay at home, take care of myself. I know how to, check my temperature. I know they're more like flu-like symptoms, but I just want to caution you that, yes, it could be COVID-19, but I would strongly recommend that you keep a diary of your symptoms, and I'll tell you why. Many times people will call the doctor and say, oh, I think I have COVID-19. They've already given the doctor the diagnosis, but they have no symptoms to tell the doctor. So the doctor has no way of knowing if it really is COVID-19. And don't forget, there are other diseases that are going around that we're not talking about, such as, viral meningitis. People can have that and feel sick also, have headaches, feel under the weather. So please keep a diary of your symptoms so that if the symptoms get worse, the doctor has something to put in her or his note, so that they can validate the fact that they suspect that it was COVID-19. Also, if you do feel worse or your symptoms are getting worse, you're not able to get up, you do need to contact your doctor and or go to a testing site that you're aware of, so that you can get tested and or, if needed, be put into the hospital. Now, there is an antibody test that some people are getting done. It's not done as often because some places don't have access to it. The more common test is the viral test. And as I said before, some doctors are electing to wait until at least 14 days, sometimes 21 days, to repeat the viral test so that they have a negative test and they know you're clear of the virus. Other doctors and other professions, the office or the HR people may want an antibody test to make sure that you have antibodies to it. And I must say that the information that I found did not clearly state that an antibody test conclusively proves that you will not get COVID-19 again. If you did have COVID-19 and the test comes back positive, that's good. That's really good. But as I said, we're all learning this as the time goes on. So we may not know completely if your immunity will fade out in a month or so, or if it's long lasting, like some of the other viruses are for years. So I want to strongly emphasize that all the measures we discussed, you need to continue to do. The face masks, the very, very good hand washing using hand sanitizer, and the social distancing. Also, there are things that can happen, especially if you've had a negative test before. There are some people who within a week may come up positive. And that could be because when they initially tested for the virus, you didn't have a lot of symptoms. So you had been around someone that you thought had COVID-19 or you knew had COVID-19, and you were just playing it safe. You just took the viral test, or you had antibody tests. But you start to have more symptoms later on, and it's been like maybe a week and a half, and the antibody test is positive. And we're seeing things like that because from time to time, people come in at a time when maybe the virus is not detectable, and then later on it is detectable. So I have reviewed with you some of the testing that is done. and talked about and emphasized the reasons why we need to continue to use our safety measures to protect ourselves, our loved ones, and other people in the community. Please follow me on Facebook, Instagram, Twitter, LinkedIn, or Pinterest. My name is Dr. Hope Watts. You spell that DrHopeWatts. Thank you. And I hope this information was very useful to you.